Today's topic is allergies, and you're definitely the expert there. Talk a little bit about allergies here on the Suncoast and why that's so important.
Sure. So, allergies here in the west coast of Florida, unfortunately, are year round because we have very warm weather and very mild winters. Our allergies are constant, pretty much 11 and a half months out of the year. We get about 2 weeks of reprieve in January when it gets cold enough just for it to frost a little bit overnight. But overall, our allergies are year round. We've got tree pollen. Currently, grass pollen is also rising into the summer months as it gets rainier and warmer, which then moves into ragweed season in the fall. And then, of course, on top of all of that, mold during the humidity and dust as well. So, Florida, particularly the west coast of Florida, is very warm, very humid, and so allergies are constant.
The difference between treating an allergy versus a common cold, what do you say to that, and what does that look like?
Yeah, a lot of the times the symptoms of allergies and the symptom of a cold or flu are very similar: runny nose, headaches, sinus pain and pressure, congestion. But one of the biggest things is with allergies, you wouldn't necessarily get a fever. So that's one thing to look out for sinus infections, colds, flus. You wouldn't necessarily get body aches or fatigue with allergies, where you would with the flu or a cold. And of course, allergies more seasonal, so they would be more prevalent this time of the year into the summer. Cold and flu season more prevalent during the winter months, which would be like December, January. And then, of course, having children in the home, more likely to get a cold or a flu.
Hurricane Ian came through the area and did some damage in a lot of the trees and debris. A lot of areas were destroyed, so to speak. And now that the lands look different, talk a little bit about that effect it can have on allergies.
Sure, yeah. So Hurricane Ian happening right in the middle of one of our allergy seasons, which was ragweed and grass season in September, October, definitely had a huge impact on our allergies. So the first was the very nice weather after Hurricane Ian resulted in an out of season tree pollination. And so we actually had trees pollinating in the middle of the fall, which is not common at all. So that's the first thing. The second thing was all of the debris, the trees that were uprooted, that obviously our cleanup crew couldn't get to all of them all at once, resulted in mold and rotting. And so then you had excessive mold spores in the environment as well. And then it was very windy in a dry winter. And so the wind kicked up a lot of the debris and a lot of that mold. And then finally, if that wasn't bad enough, Hurricane Ian disrupted our natural biodiversity of Florida. We uprooted a lot of trees and a lot of bushes, which leads to loss of insects and birds. And just the same way that people lost their homes, our animals also lost their homes. And those animals are necessary to maintain, an equilibrium and biodiversity here in Florida. And so I think a lot of ecologists and biologists don't really know what the impact is going to be for Hurricane Ian, at least for another year. But I think it's going to be a long-term effect. Not just the environment that we're in, but also the homes that were destroyed and people still living in those homes, unfortunately, because they don't have other options, with the mold and the dust and the debris, things like that. And so there's a lot of just destruction and damage that still is out there that unfortunately is just taking time to clean and pick up.
What do you tell people who get a report tonight and they learn a little bit more about allergies and, as it relates to the Suncoast? Should they be alarmed? What should they do? Should they mask up? What should people do, or what are the takeaways you would give people?
Yeah, so almost everybody suffers from allergies. I've yet to meet somebody that doesn't have allergies, especially this part of Florida, given the temperatures and everything. So as far as being alarmed, I would say it's definitely not something that I would be super concerned about unless you're having really bad breathing issues, infections, sinus infections, pneumonias, bronchitis, these kinds of things. Then you definitely go see your primary care doctors and maybe an allergist like myself that can help you. One of the complications from allergies is asthma, is breathing problems, is sinus infections. And so if that does happen, that's definitely a trigger for patients to come and see a specialist. To get some allergy testing. Allergy treatment options can include medications. It can include allergy injections, which we administer here in the office. It can include many different things. So there's lots of different approaches to treat allergies. There's not just one option for patients out there. It's all different, unique, and customizable for everybody. But if you're having significant symptoms and you're really worried about, your breathing and your sinus pain and infections and things like that, then that's definitely a situation where I would call a specialist.
When you have pet dander from animals that we love, smoke, and enclosed environments that may not have the best circulation, is that a challenge, or is that something that we should think about? And then when you have air filters and different systems you can use, does that help? What would you say to that conversation?
Yes, so animal dander is also a very common allergen. Along with animal dander is dust and mold, which are indoor allergens. And as far as pets go, we never tell our patients to get rid of their pets. We're not in the habit of doing that, obviously. But what we do is we give patients and families tricks and tips on how to minimize animal dander. For example, keeping animals groomed properly, washed, hair short, not allowing them in your bedrooms, on the bed, on your pillow. For example, washing your hands after you play with them. That all can help minimize the contact with the skin, the eyes, and the nose with pet dander. And as far as dust and mold goes, one of the best ways to minimize dust and mold in your home, number one, is to make sure that the humidity is 40% or lower. And the other thing is to have a good air filter, like you mentioned. So if you do have an air conditioning unit that has air filters, I recommend changing them every month. Most air conditioning companies, I believe, recommend every 3 months, but for the allergic asthmatic patients, we always say once a month. Additional air purifiers that you can get at your regular retail stores also help minimize circulation of dust, animal dander, and mold as well. The biggest thing about that is you don't have to get a fancy one. You just have to take care of the one that you have. So you want to replace the filters, make sure it's clean, and that you're using it in the appropriate space that it's meant for. So every air filter has the square footage listed on the box. And so it'll say appropriate for a 500 square foot home, room, or 800 square foot room, for example.